Hello, I'm Dr. Sandra Freihofer. Welcome to Medicine Matters. The topic, highlights from ACIP's October 2024 meeting with new recommendations for pneumococcal, COVID, and MenB vaccines. Also, a new safety update for maternal RSV vaccination. Here's why it matters. For pneumococcal vaccination, ACIP's lowered the age for routine vaccination from 65 down to 50, but only with PCV, the pneumococcal conjugate vaccine. Here's why. More than half of those aged 50 to 64 already had a risk indication to get it. Also, rates of invasive pneumococcal disease peak at younger ages in Black patients as compared to white. In fact, the rate of IPD, that's invasive pneumococcal disease for Black adults aged 50 and older, exceeds the average rate of IPD for all adults aged 65 and older. This new age-based change should reduce disease in the demographic groups with the highest burden of disease. The risk-based recommendation for those 19 up to 50 still applies for those with certain medical conditions like diabetes, chronic heart, lung, liver, or kidney disease, and also for those with immunocompromising conditions. But understand, risk-based recommendations are harder to implement, particularly since many vaccines are now administered in pharmacies, and pharmacists don't know the patients as well as we physicians do. So it's harder for them to know who should get it if the recommendation is based on risk. The new recommendation is for pneumococcal vaccination for everyone starting at age 50 and only for PCV, pneumococcal conjugate vaccines. And remember, conjugate vaccines trigger memory B cell production and therefore induce greater long-term immunity. New research is now focusing on higher valent PCV vaccines. In fact, 2 24-valent vaccines and 1 31-valent pneumococcal conjugate vaccine are now in advanced stages of development. Next up, COVID vaccines and additional doses for some. Everyone 6 months and older is recommended to receive a dose of the updated COVID vaccine. That hasn't changed. But an additional COVID vaccine dose is now recommended for everyone 65 and older, and also for people aged 6 months and older with immunocompromising conditions. Here's why. 1 in 6 patients hospitalized with COVID has an immunocompromising condition. 70% of COVID hospitalizations are in those 65 and older. They also have the highest death rates due to COVID. We know that vaccination protection wanes with time. Data from previous studies shows additional vaccine doses provide additional protection. Additional doses are now being recommended for those at highest risk. This second dose is recommended at 6 months, but can be given as early as 2 months after the last dose. And if you recently had COVID, you can wait 3 months before getting an additional vaccine dose. This flexibility allows patients to maximize additional protection by timing additional doses around travel and life events like weddings, family get-togethers, chemotherapy, etc. Patients with immunocompromising conditions can also receive even more additional doses if recommended by their physician under shared clinical decision-making, meaning you and your patient have to discuss and decide. Now for the new dosing recommendations for MenB vaccination. Meningococcal disease is rare but deadly, and the disease progresses rapidly, meaning you can get real sick real fast. As many as 10 to 15% of people with meningococcal infection die, even with appropriate antibiotic therapy. And for those who do survive, about 20% of them suffer long-term effects, including cognitive deficits, hearing loss, and limb amputations. The new ACIP vote only applies to MenB vaccination. Remember, there are 2 MenB vaccines, one by GSK, brand name Bexsero, and the other by Wyeth, a Pfizer subsidiary, with brand name Trumenba. The 2 MenB vaccine products are not interchangeable. The same type of MenB vaccine has to be used to complete the series. The MenB vaccines initially had different dosing schedules, and now they don't. ACIP voted to harmonize and align the dosing schedule for the two different MenB products to mirror recent FDA labeling updates. So now the dosing recommendations for both MenB vaccines are the same: 2 doses given 6 months apart if given to healthy adolescents and young adults, and a 3-dose series given at 0, 1 to 2 months, and a 3rd dose at 6 months for those at high risk. And also for those who want to optimize rapid protection. For example, if you're starting the series within 6 months of going off to college. But understand the current recommendation for MenB vaccination for healthy adolescents and young adults is based on shared clinical decision-making, preferably for those aged 16 through 18. But for MenACWY, 2 doses of MenACWY are routinely recommended, the first dose at age 11 to 12 and a second dose at age 16. And the MenACWY vaccines are interchangeable. Having to use the same type of MenB vaccine product and all doses in the series makes implementation difficult. And it's even more difficult for those who receive both MenACWY and MenB vaccinations. That becomes even more complicated. Adding to that complexity is there's now a new pentavalent vaccine called Pembrya that combines MenACWY with the MenB vaccine version, and another pentavalent vaccine version by GSK based on the other MenB vaccine is up for regulatory decision in February 2025. The work group did say that they plan to take a fresh look at the meningococcal vaccination schedule. Let's only hope it gets more simple, so more to come on that. Let's end with a quick review of RSV. Everyone age 75 and older needs a dose of RSV vaccine. So do adults age 60 up to 75 with risk factors for severe RSV. Those 60 to 75 without risk factors are no longer recommended to receive it. And we now have 3 RSV vaccines to choose from. 2 protein subunit RSV vaccines, one by Pfizer called Abrezvo that does not contain an adjuvant, and one by GSK called Arexvy that does. And a 3rd RSV vaccine by Moderna called Imresvia that uses an mRNA vaccine platform. And here's some good news. Studies now suggest the RSV protein subunit vaccines confer 36 months of protection rather than just 24 months. All 3 of these RSV vaccines are licensed for those 60 and older. The age indication for GSK's RSV vaccine, Arexvy, had already been lowered by FDA to age 50, and FDA recently lowered the age approval for Abrezvo down to 18 for those at high risk. But at least for now, ACIP has not yet expanded its age recommendation for getting them. One of the main hesitations goes back to vaccine safety concerns. FDA's vaccine safety update presented at ACIP still suggests an increased GBS risk with both protein-based RSV vaccines among those aged 65 and older. Fortunately, so far, the risk is rare, less than 10 cases per 1 million vaccinations. And for protecting babies, we are now in RSV season. RSV season starts in October and goes through March, and we have 2 new ways to protect little babies. A maternal RSV vaccine given at 32 to 36 weeks to moms who will deliver their babies during RSV season, but only the one by Pfizer called Abrezvo, the one without the adjuvant, and also nirsevimab, a long-acting monoclonal antibody given to baby. Nirsevimab's indicated for all babies under 8 months old entering their first RSV season. A maternal RSV vaccine safety update presented at ACIP was reassuring. It found that Abrezvo was not associated with increased risk for preterm birth or small gestational age at birth. And to clarify, people who received a maternal RSV vaccine during a previous pregnancy are not recommended to receive additional doses during future pregnancies. However, infants born to people who were vaccinated during a prior pregnancy should receive nirsevimab. And that's not all. ACIP also voted on the new adult schedule for 2025, and we'll talk more about that when it goes live. I hope this update has been helpful. For Medicine Matters, I'm Dr. Sandra Freihofer.